Welcome to Nasdaq Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq. Joining me at the market site Times Square, New York City, we have Andrea Pais. She is the founder and CEO of Microdevices. We're going to learn about molecular diagnostics and more about the company. It's great to have you with us at Market Site. Tell us more about Microdevices and the products that you're developing.
Sure. So we are an in vitro diagnostic devices company, and we're developing a way for running these complex lab tests for infectious diseases at the point of care. So for that, we've developed an ultra-portable molecular diagnostic device that can run a PCR or a complex lab test at the physician's office so the patient can be tested and treated immediately. And it works very easily. All the physician has to do is take a raw sample, a drop of blood or urine, put it into the device, insert this cartridge into our system, and within 20 or 25 minutes you have a result for whether the patient has flu or an STD.
You don't have to wait like those 2-3 days for it to grow
Exactly.
in the culture anymore.
Yeah.
So tell us a little bit more about molecular diagnostics. What is that about?
So molecular diagnostics are very complex lab tests where you are looking at the DNA or the RNA in the test or in the organism. You're detecting the organism by looking at the DNA or RNA sequences. And historically, these tests have been performed at labs because they involve very complex equipment as well as infrastructure, and they also involve very skilled personnel. We've developed a microfluidic cartridge that automates all these lab processes on a very easy to use platform. So the clinician, all he has to do is just put a drop of the sample into this cartridge and put it into our device.
Oh, well. Maybe for healthcare consumers, it could also help bring down some costs,
yeah,
too, which would be fantastic.
That would be very interesting. But we're working to commercialize in the clinical market as first.
What are some of the diagnostic tests that you have in the pipeline?
So our first test is a test for sexually transmitted infections, chlamydia and gonorrhea, and we're also looking at super gonorrhea or drug-resistant strains of gonorrhea. Our test would actually enable the clinician to detect what drug the gonorrhea is susceptible to or resistant to, so they can prescribe the right antibiotics because there is a growing threat of antimicrobial resistance.
And so this would be used, like you had mentioned before, it could be used right in the doctor's office. You don't have to go separately for a lab. And we talked about potential cost savings there, but how will people benefit in other ways?
So people getting tested and treated immediately, that's basically going to be able to reduce the disease spread, potentially. Peace of mind as well, so you can know if you have a disease and get treated immediately, and also getting very precision cure or antibiotics for treatment.
All right, now to wrap up here, what stage are you at? When do you plan to launch?
So we are in the development stage. We have a prototype, and we've tested our device with clinical samples, and our device is essentially equivalent to the lab test in sensitivity and specificity. So we're essentially running that same lab test on our device, except that we're doing it in a much more easy and user-friendly way. We're currently developing a beta device, a beta prototype that will get into clinical studies, and we hope to launch by end of 2022 or 2023.
So Andrea, thanks so much for joining us at Market Site. And thank you for joining me on Trade Talks. I'm Jill Malandrino, Global Markets Reporter at Nasdaq.